Hi, and welcome to this NED Talk from the Nutrition Evidence Database. Today, I have the pleasure of having expert reviewer Kirsty Baxter on the NED Talk platform, and we are discussing a 2021 systematic review and meta-analysis from the clinical research edition of the British Medical Journal. The study we are discussing looks at the efficacy and safety of low and very low carbohydrate diets on type 2 diabetes remission. So welcome to the NED Talk platform, Kirsty.
Thanks very much, Claire. Lovely to be here.
Excellent. I'm just going to stop sharing, but you can see the study here on the database. And if you scroll down, then you get access to Kirsty's review. But I'll stop sharing now, and then we'll get into the questions. So last week I was talking to the expert reviewer Daniel Quinones about the effect of a ketogenic diet on type 2 diabetes markers. So how do the diets used in this review compare to the ketogenic diet? And will some of the low carbohydrate diets that were used in the study actually result in ketosis for some?
Thanks, Claire. Yes, that was such a great interview with Daniel Quinones and a very good question for nutritional therapists. So a ketogenic diet is typically described as a low-carb diet, but with less than 20 to 50 grams of carbohydrates per day, or less than 10% of a 2,000 calorie per day diet. And that's sufficient to induce ketosis. However, in this systematic review, they chose a low carbohydrate diet, which they defined as having less than 130 grams or less than 26% of calories from carbohydrates based on a 2,000 calorie per day diet. So ketosis was unlikely to be achieved, even though it was a low carbohydrate diet.
Okay, interesting. It's good to know that distinction. So this study was looking at type 2 diabetes remission. So could you talk a little bit about that and how it was measured?
Yes, Claire, thank you. Remission of type 2 diabetes is actually defined as both having HbA1c less than 6.5%, or in terms of the NICE guidelines target range of 48 millimoles per mole, or a fasting glucose less than 7 millimoles per liter, and that is with or without diabetic medication for at least 6 months. And this definition of remission has actually been agreed by a team of international experts from Diabetes UK, the American Diabetes Association, and the European Association for the Study of Diabetes. So it's a really well-recognized definition for remission of type 2 diabetes.
Fantastic. That's excellent. Thank you. So in summary, then, what were the results that were reported in the 23 studies that were included in the systematic review?
Yeah, so some really interesting and positive results in this study where participants adhering to their defined version of a low carbohydrate diet for 6 months experienced remission of type 2 diabetes without adverse consequences. And additionally, clinically important improvements were also seen in weight loss, triglyceride levels, and insulin sensitivity at 6 months, although it must be noted that results diminished at 12 months.
Okay, great. So type 2 diabetics typically will be under the care of their GP and likely be on some form of medication. And it's always wise when considering dietary change to discuss this with your healthcare team and be under the supervision of a nutrition professional. Were there any adverse reactions mentioned in the review and any indication of a low carb diet being suitable or not being suitable for some?
Yes, Claire, although the systematic review reported no significant or clinically important increases in adverse events, we know that safety concerns have been raised with low carbohydrate diets in the literature. And while low carbohydrate diets are seen to promote reductions in things like HbA1c, they potentially may also increase the risk of hypoglycemic episodes, including severe syncope, where there's a total or temporary loss of consciousness. So this is really relevant if the dose of diabetes medication is not adjusted according to the diet. And hence, a low carbohydrate diet should be implemented by clinicians for the management of type 2 diabetes, always in conjunction with a general practitioner to actively monitor and adjust the diabetes medication as needed.
Fantastic. Yeah, okay, really good advice there. So what are your key takeaways from the study that you've done the expert review on?
I think it's great for us in terms of providing an evidence-informed modifiable dietary and lifestyle change, to know that a structured low carbohydrate diet is a worthwhile option for the management of diabetes alongside general practitioner interventions. And this provides nutritional therapy practitioners and nutritionists an opportunity to support clients in this area that's really relevant in an ongoing area where diabetes is really just such a widely experienced condition.
Fantastic. Yeah, excellent. So thank you so much, Kirsty, for your insights on this study. So once again, we see that with only a change in diet, that significant health improvements can be achieved. So you can read all about Kirsty and how to connect with her on the Nutrition Evidence Database under the Expert Reviewers tab. And you can access Kirsty's full expert review on the database at the link provided with this video. And there's actually an additional review that Kirsty's also done on a similar topic. So that's worth checking out. So thank you very much for listening to this NED Talk Bite Size, brought to you by the Nutrition Evidence editorial team in partnership with BANT. Tschüss.